Up next on The Reveal.
Georgia continues to see near record levels of new COVID-19 cases.
From lockdowns to loneliness.
We didn't realize that everything was going downhill.
To mask mandates and flattening the curve. The lessons we've learned and the signs of hope from 1 year of living amid a global pandemic. Then,
I trusted them.
the struggle to keep people protected.
I can say wholeheartedly that Mom did every single thing she could to stay safe.
She did. She even slept in her mask.
The Reveal investigates claims that some facilities still are not doing enough. Plus,
I look forward to nighttime when I can sleep. And I hate the mornings when I have to wake up because you're in pain. And that's no way to live.
an in-depth look at the long haul that COVID survivors are in for. The Reveal takes you inside the new plan to tackle the virus' lasting effects. From our Midtown studios in Atlanta, The Reveal begins now with our multi-Emmy and National Mural Award-winning team of investigators.
Welcome to The Reveal. This time last year, our lives changed forever as COVID went from a deadly virus in China to a real threat here in Georgia. Early on, I was asked to create a database that would help us track the virus's impact. Now, as we mark 1 year since that first positive case was announced here in our state, we look back on some of the data that helped shape our response to the disease. Hi, this is Rebecca Lindstrom with 11 Alive. How are you? When I left my desk in February last year to work from home, I seriously thought I'd be back in the newsroom a few weeks later. Instead, my closet has become an audio tracking booth and my bedroom, a makeshift studio. Who knew last year words like PCR, quarantine, intubate, and antibodies would become household terms?
We need to ensure that it's communicated with the public in a way that it's understandable, meaningful, and actionable. And we're failing in that regard.
And that's why data has become essential to accountability. Numbers, now that's my niche. Our database tracks dozens of metrics every day. I won't tell you the exact number, you can see that on your screen. But I will tell you what I have experienced through them.
Now, Georgia continues to see near record levels of new COVID-19 cases and people needing medical care.
For a year now, we've watched as Memorial Day, the 4th of July, time with friends and family at Christmas, all led to new record numbers in positive cases and eventually deaths. Heading into March, 55,000 people in Georgia had gone to the hospital seriously ill with COVID.
We didn't realize that everything was going downhill.
More than 15,000 had died. We were worried the protests this summer would also impact spread, but knew the voices of those marching for police reform and racial equality needed to be heard, just as those heading to the polls needed to cast their ballot. I remember the sense of community last spring. Hospital staffs celebrated as patients, once sick with COVID, were well enough to go home.
It gives some purpose for us.
People found ways to print 3D masks for healthcare workers, and others bought out craft stores to sew masks and gowns when supplies were nowhere to be found. When we believed COVID only impacted the elderly or those with chronic health conditions, children stepped up, demanding they not be forgotten.
She can barely do 30 minutes of activity without being completely wiped out.
Maybe they didn't pose as much of a threat to the spread of COVID, but they could still get it.
You know, I missed my sister. I missed her a lot. And the raindrops represent how give it the sad vibe.
Were you ever scared?
Yeah, sometimes.
And they were not immune from the isolation and loneliness that came from quarantine. This past year, we've learned COVID isn't just about those that are hospitalized.
And I hate the mornings when I have to wake up because you're in pain. And that's no way to live.
About 10% of those who tested positive are still battling long-term health effects. Runners now struggling to walk up a hill.
You know, at one point we didn't have enough testing.
Well, last spring, the lack of test kits led to long lines and frustration. This spring, it's vaccine that's creating the panic. For some, the past year has been an inconvenience, but for others, it represents a lost job. a lost dream as a business closed for good.
I've been struggling.
And there are families still fighting to pay their rent or mortgage, worried COVID will also mean a lost home. As the number of new COVID cases start to slow, exhausted frontline workers wonder if they'll soon be able to pack up the makeshift hospital tents and mobile buildings that have flanked their front doors. But of all the data points I could share, I can't even count how many hugs I wish I could have given.
This life taking is real. This hurt is real. This pain is real.
To the woman who shared the story of her father's life and death to push back at those who claimed COVID wasn't real.
No, and it's a horrible feeling.
To the residents in nursing homes that just wanted to be touched.
He asked me to pray with them before we put him on the ventilator. And he passed away a couple of days ago. So knowing that was the last words he heard, just makes me thankful that I got to be a part of that.
To the doctors that shared what it was really like inside the ICU in hopes people would wear a mask or just stay home. Sure, it would be great to again sit at my desk, but it would matter so much more to hug and to hold. And I hope that is the story we tell next year when we talk about COVID.
Coming up on The Reveal, they believed their mother was safe.
I trusted them wholeheartedly, and I wish I hadn't.
The Reveal uncovers how nearly 24 died in nursing homes after repeated health inspection warnings.
For more on these investigations or to submit a tip to the Reveal team, text REVEAL to 404-873-9114 or email us at thereveal@11alive.com.
Welcome back. A Reveal investigation uncovered state health officials repeatedly warned a Metro Atlanta nursing facility it wasn't doing enough to protect residents from COVID infections. Months later, an outbreak did hit the facility and nearly 24 people died. But it may be almost impossible for families to hold that nursing home accountable.
Good morning, everyone. This is Lori from Westbury, and our entire team is at work here on this beautiful Saturday morning.
A nursing home administrator records a message reassuring families they are doing everything to keep their loved ones alive.
We have completed this week's testing of all residents, and we have 2 new positive cases of coronavirus.
I trusted them wholeheartedly, and I wish I hadn't.
Teresa and Lashika's mom, Bessie Burden, lived at the Conyers facility for 7 years. The 77-year-old grandmother suffered from diabetes and was wheelchair-bound but remained active. Crowned Miss Westbury 2 years in a row. All that changed when the pandemic hit. The social butterfly stayed in her room. Lashika, a registered nurse, made sure her mom followed the CDC guidelines.
I can say wholeheartedly that Mom did every single thing she could to stay safe.
She did. She even slept in her mask.
Then, this past October, their mom mentioned her roommate started showing COVID-19 symptoms.
She was coughing. I would be on the phone and she said, "See, you hear her? She's coughing, she's coughing."
One morning, staff took Burden's roommate out of her room with little explanation. A few days later, Burden started falling ill herself. While on the phone with her mom, Teresa could hear her struggling to breathe. She then called her sister.
I said, "I need you to go to Westbury, sit in the parking lot and call 911. I said, "Get an ambulance and get Mom out of there immediately."
Rockdale 911, what's the address of the emergency?
I have an elderly parent that is having difficulty breathing and starting at 85% according to my mom, and I need to have her transported to Emory Main campus.
A few days later, on October 20th, the Georgia Department of Community Health issued a report identifying several violations that put residents in immediate jeopardy by keeping COVID-positive and negative residents in the same units, improperly performing COVID tests, and failing to notify the Department of Health. What's worse, the state warned the facility 2 different times over the summer it was not doing enough to prevent infection, citing it for not following infectious disease protocols in June and then again in August. What was their response?
She said that they failed us. They said, we know we failed you.
10 days after Burden arrived at the hospital, she died of COVID-19, the last time she spoke to her daughters over FaceTime.
One of the most important things that my mom said to us was that she was thankful that we came and got her.
Since March, at least 85 of Westbury's residents have contracted COVID-19. 22 of them have died. Burden's daughters want to hold the nursing home accountable for their mom's death, but not one attorney will take their case.
They're immune.
Moses Kim is one of them.
The public's rights are being robbed.
The Atlanta attorney is talking about 2 things Georgia lawmakers did during the pandemic that gives nursing homes immunity to most lawsuits.
They have tested 46% of nursing home residents.
The first, Governor Brian Kemp signed an executive order limiting liability even if staff admit to making a mistake. The second, the state legislature passed a temporary law preventing most lawsuits against healthcare facilities, just as long as owners post signs like these, alerting the public they assume risk if they enter.
And what's at stake is the well-being of our family members. When no one's kept accountable, what happens? People misbehave.
Westbury declined to be interviewed, but in a statement wrote, "We are devastated by the impact COVID-19 has had on our center. We have made good faith efforts to mitigate the spread of the virus based on rapidly evolving guidance."
There's nothing that will bring her back. There's no amount of money that'll make it better, but I would like them to be held accountable.
Since Andy's investigation first aired in January, the family has hired an attorney to pursue litigation. But it's unclear if they will successfully be able to prove gross negligence as required under the state's current immunity rules. Georgia's law temporarily limiting liability isn't set to expire until July of next year.
Up next, they're called the long haulers.
Because I didn't know if I was going to make it through the day or not. And so it's been scary.
Why some symptoms of COVID linger longer after the virus vanishes. The new push to help those who survived but are still suffering.
By now, you've probably heard the term long hauler. What you may not know is just how many people fit that description. Doctors now estimate 10% of those who contract COVID will end up with long-term health effects for months to come. That is 2.8 million people and counting. But our medical community still has no idea what to do about it.
I don't know what I'm going to do.
Caroline Wallace has 2 letters saved on her computer, written as she struggled to breathe.
Because I didn't know if I was going to make it through the day or not. And so it's been scary.
They are letters for her 2 boys, to Sam and Max, upon my death. Even though now she's technically COVID-free, she keeps them.
I don't know if I'm going to get any better. I look forward to nighttime when I can sleep. And I hate the mornings when I have to wake up because you're in pain. And that's no way to live.
11 months after her diagnosis, this avid runner can barely walk up a hill.
All I want to do is put my running shoes on and go for a run again and feel good afterwards. That runner's high. This is what I'd love to feel.
Instead, she is exhausted. Her voice fades trying to talk, and the cough
At the end
never stops. She has spent thousands of dollars on tests and treatments that insurance wouldn't cover.
One puts me on this medicine, the other one puts me on another medicine, and I feel like I'm a pharmaceutical at the end of the day, and yet nothing's really helping. So, I don't know, I'm lost.
Her medical chart says she's fine. At least one doctor told her it is all in her head.
I felt so dismissed and alone and crazy.
We see with COVID.
Pulmonologist Jermaine Jackson sees that desperation every day. Studies affirm the problem. 75% of patients in a Chinese study continued to have at least one COVID-related symptom 6 months later. And an Italian study found a similar trend in children.
One of the things I like to stress to the patients and reassure them that what they're experiencing is real.
The goal of Piedmont Healthcare's COVID recovery clinic is to build one plan of patient care from physical therapy to neurology. What do you do if all the tests that you know to lean on tell you nothing's wrong?
We're building the plane as we fly it. With each passing day, we learn more and more.
Surprisingly, Dr. Jackson says long haulers are often young, perfectly healthy, and physically fit. Many were never admitted to the ICU for COVID, let alone intubated.
It's important that we don't allow them to just fall by the wayside, that we treat it like a chronic disease process.
Emory and Wellstar Health Systems say they too have or are in the process of creating post-COVID care units. And Redmond Regional in Floyd County has an outpatient rehab program. But most hospitals are still leaving it to the individual doctors to figure out.
My hope is that we can provide a way and be pioneers for a lot of those programs that are out there that are looking to start up.
COVID can really act like a ticking time bomb.
Diana Barrett has her own COVID story.
I also did have a diagnosis of COVID onset glaucoma.
And long-term health impacts.
We are tracking infections, we are tracking hospitalizations, and we are tracking mortality. And so with that comes the assumption that everybody who has survived has recovered. And unfortunately, that is far from the truth.
Initially, Barrett created Survivor Corps to encourage those who recovered to help medical research.
I'm here. I'm donating plasma. We are mobilizing an army of survivors to donate their plasma and to support science in every way possible, because so many of the answers to the mysteries of this virus lie in the bodies of survivors.
But Survivor Corps now has a second, kind of unofficial purpose.
I'm really out of breath.
A support group.
I am really emotional right now.
We have created a community of 150,000 strangers who are helping each other, who are there for one another in the middle of the night and answering each other's questions when doctors don't have answers.
Barrett says these stories represent the largest data set on non-hospitalized patients in the world. And another group, all researchers living with long COVID, have started their own surveys. Patient-led research, and Barrett say this is an important group we need to study.
They did not receive anticoagulants, interferons, antivirals, steroids, etc. And so they are having a very different disease trajectory.
Short-term memory loss, brain fog, and fatigue are the most common, certainly for Wallace, who instead of celebrating as her sons graduated from high school and college, laid in bed, miserable.
I have been an absent parent during some pretty cool times. Yeah, those letters will stay on my computer until I get better.
Wallace did get an appointment at Piedmont's long-haul clinic, but canceled. In an email, she explained, "I have given up hope and am trying to learn to live and work full-time in a new way. I just can't keep up the fight and cost of it." If you have a story you'd like us to investigate, email us at thereveal@11alive.com. Thank you for watching. We hope to see you next week on The Reveal.